All right. Well, it looks like we're all here. So good evening again, friends, and welcome virtually to University of Puget Sound. My name is Robin Aijian. I have the honor of serving as the Senior Director of Admission. I'm also a graduate of Puget Sound. And I'm joined today by my friend and colleague Nova Ferguson from Health Professions Advising, and several student and alumni representatives who are here to share their experience as well. So we're really pleased to be here with you this evening. It's an exciting time in college admission as we're working with admitted students who are getting ready to make their college choice. So welcome to our virtual night for health professions advising. And for all of you, just congratulations for getting to this place in your college search. You're in. Many of you have made your college choice. Others are gathering information, weighing your choices. And before we get further, I just want to say congratulations. This is exciting. Take a deep breath. Enjoy this moment. We are going to be conversational here this evening, but we've really designed the program to make sure you learn everything you need to know about health professions advising at Puget Sound. So just a few housekeeping notes from me before we get going. This is set up as a Zoom webinar, not a meeting. So attendees, we can't see or hear you, and you can't see or hear each other. We are, however, really eager to hear from you and to take your questions. So we're going to do that this evening through the Q&A feature in Zoom, not through the chat. And if Q&A is not showing up for you, you might have to mouse over the Zoom bar, click on More, and then the Q&A feature will open up. And we actually have a team of admission counselors who are working behind the scenes here at the Welcome Center, who are going to answer your questions individually to the best of their ability. We're also going to take as many of those questions live as we can. So if your question isn't getting responded to right away in the Q&A, don't worry, that's likely going to get floated to the group for discussion. If you need to leave early or if we aren't able to get to all the questions, please do not hesitate to email us at admission@pugetsound.edu. And that should be an email address you're fairly familiar with already. If you haven't done so already, I do hope you'll take the opportunity to visit campus and see for yourself what makes us so special. We have one more admitted student event happening on April 17. We have visits 5 days a week, Monday through Friday, 3 times a day. You can find all the information you need at pugetsound.edu/visit. And with that, I'm going to get out of the way. Let's get started. Do remember, use the Q&A feature. And if you have questions that come up while we're talking, please drop those in there. And without any further ado, then I want to introduce Nova Ferguson. Nova, do you want to take a moment to introduce yourself and share a bit more about your role at Puget Sound?
Yes. Hi, everyone. Thank you, Robin. It is really fun to be with you all this evening. Chatting with the incoming students and getting to know y'all at the front end is particularly special because I get to hang out with y'all for so many years to come as pre-health students. And so I think back on who some of our starting med school students were and dental school applicants, and think about who they were as high school seniors and incoming first year students, and then to see them matriculate and project into these just wonderful adventures is particularly special for me. So someday I will be thinking about meeting you all for the first time in this space. And I've seen some of the names, and I know some of you I've had a chance to meet already on campus during visit days and through some email correspondence. And so it's really fun to see you all again. Okay, I'm going to go ahead and get us started and share my presentation. All right, let's just give it a sec. We'll kind of get everything going. Okay, does everything look okay, y'all? All righty, wonderful. Okay, so this will be a fun evening. I'm going to talk a little bit about what does it mean to do pre-health advising here and what is the Puget Sound structure and model. I really want to give the bulk of our time to our wonderful students and alumni who are joining us, because I think there's nothing more special than hearing their story. They've lived it. They've been in your shoes recently. And I think it's just an extra special treat to hear their perspectives and advice that they would give you all as you embark on this next part of your chapter. So the journey we're going to travel this evening, I will talk about the numbers. Acceptance rate numbers are always the top question I get asked. And so I will talk about acceptance rates, but also just a little bit bigger lay of the land of what does the pre-health community look like here at Puget Sound. I'll talk about, again, how we do pre-health advising, the structure, the model, the format. The general traveling journey you're going to embark upon, knowing that everybody's is different, but I'll give you a very 30,000-foot look of what does that look like perhaps here at Puget Sound for you. A lot of incoming pre-health students come in with credits, AP, IB, community college, running start, college and the high school. I'm not going to go into detail about this, but I will talk about just some general things to be in consideration if that describes your situation. And then again, the majority of what I want to do is have our wonderful students and alumni share their stories. So without further ado, I'm going to jump in. Okay, basic numbers to help orient y'all to pre-health advising here at Puget Sound. We are very, very fortunate that we have a large number of students who identify as pre-health here on campus. This is not typical for a private residential liberal arts campus. It's quite special. And sometimes I think we forget that that's special, but I just love it. What it means is that you are in really good company here on campus as a pre-health student. So at any given time, you're 1 in 4-ish of the students are going to have a similar type of professional career path as you. It means that there's community everywhere. And I think that that's a really important part of what makes our pre-health students successful and makes them feel really integrated to our campus. A lot of our pre-health students are also student athletes. Again, this is not always the case. Last year, 38% of our pre-health students were also varsity athletes. What that means is that you don't have to pick and choose between being pre-med or being a member for your collegiate athletic team. You really can embrace both of those identities and recognize that they are often quite complementary. You don't have to pick and choose. A lot of that is because the coaching staff is sincerely supportive of our pre-health students, and they recognize that yes, sports are really important. And you're here because you're preparing for the next adventure, which is presumably to jump into a career, a professional setting, a graduate program, and they want to be a partner in that. So I'm very lucky to work with such wonderful coaches who are really kind of in the sandbox with me. Our location is quite special. So from campus, we have 4 hospitals within a 2-mile radius. What that means is that clinical experiences in a hospital setting are accessible to our pre-health students. Now, 3 of the 4 hospitals are actually within a 1-mile radius of campus. So you can drive. If you have a car on campus, you can bring a car and you are welcome to drive to them, but it also means that you can walk, bike, scoot, carpool. There's options and they're readily accessible. There's a level 3 trauma center, 2 level 2 trauma centers, and then a comprehensive children's hospital. We also have really robust and dynamic partnerships with these hospitals in terms of volunteering and internships and formalized educational experiences. Also, a lot of our students and applicants want to get experience in outpatient settings and outpatient clinic settings. And so that's, of course, a feature of where we are as well. But in terms of traditional big hospital settings, we're quite lucky to have all 4 so close to us. A couple other dates or numbers for y'all just to look at. Something I want to point out is the Health Professions Advising Committee. That is in any given year, 25 to 30 faculty and staff across campus who participate in a number of things to support our pre-health students, including things like mock interviews and a number of other initiatives for our department. The special thing about that committee is that it's comprised of staff and faculty across campus. It is not only STEM faculty, which would make sense to have a lot of STEM faculty, right? Pre-health, it would make sense to have a lot of biology and chemistry and physics and math, and we do on the committee, but we also have faculty from communication studies and business and psychology and sociology. What I think that also demonstrates is just that the pre-health support and community is really integrated across campus. And so regardless of what somebody majors in or minors in, the faculty and staff see the pre-health students on campus and they recognize the journey that you're on. Alrighty, the acceptance rates. This is what everybody always wants to know. This information is on our website. So if you go to the Health Professions Advising website and you click on prospective students, this is, I think it's maybe FAQ number 1. So it's right there for you. A couple important things I'll mention about how we do acceptance rate data. So what we're doing is we're calculating data over 4 application cycles and we're averaging that. Okay, so these numbers are for those who entered their graduate programs, med school, dental, pharmacy, nursing, whatever it was, from 2022 to 2025. Okay, so it's a 4-year average. And it reflects applicants who worked with Health Professions Advising for advising support. It's a very important thing to keep in mind. Numbers don't mean anything unless they're contextualized, right? It's like the number one idea of statistics. So in parentheses, I've put the national average just for as a comparator to kind of contextualize what these numbers are. The numbers are strong. They are. Our students are incredibly successful. I'm very lucky to work with them. And so it's just really a joy and a privilege to see them navigate this journey. If you've visited campus, you have probably seen this image on the left side of the screen. This is a poster that, again, just provides some visual representation of where our students have gone for their graduate programs. This hangs outside of my office in Thompson Hall. It's also in the Welcome Center, so it's in a couple places on campus. What I always like to point out is that our students go far and wide. Because our students come from all over the country, we really do then send our students all over the country for their graduate programs. And so it's a really fantastic diversity and variety of graduate programs that our applicants get to then embark upon. Okay, I'm going to try to speed through this because I really want to get to our actual students and alums. Pre-health advising here at Puget Sound. It is this lovely little diagram, and it's very intentional by nature. So in health professions advising, we combine career counseling, academic advising, and college counseling all into one. And that's because it's really hard to separate it out for our pre-health students, okay? So the career counseling part, if you're coming in and you're thinking, I think mostly I want to do PT, maybe OT, but possibly athletic training, and I don't know, maybe pharmacy too, just for kicks. That's fine. We can do them all in the same space, and we will do a lot of self-reflection and unpacking of where ultimately is the best route for you for a long-term profession and career. So that career counseling, discernment, exploration part is a big part of the work that I do, particularly with our incoming first and second year students. Academic advising is the actual nuts and bolts of what classes do I take? So if I want to apply to med school, probably, but I also kind of am thinking about maybe genetic counseling. There's some similar overlaps with courses you get to take for either of those to be eligible, but there's also some important differences. And so my job is to keep all the doors open as long as I possibly can, and to keep you on track for four-year graduation, keeping in mind your major, your core requirements for general graduation requirements, and whatever those courses are that you need to get in to those graduate programs. So the academic advising piece, really the nuts and bolts and the details, and we spend a lot of time working on that. And then finally, the college counseling. That's the actual mechanics of applying to fill in the blank program. My approach, my theory philosophy is I want every applicant to apply to graduate programs one time. I don't want my students and applicants to become experts on how to get into med school. You presumably do this one time. Your job is to be an expert on you as an applicant, not the mechanics of the application service and the portal, okay? That's my job. So there's a huge amount of support and guidance on the actual mechanics and logistics of getting in to these graduate programs. I think this might be my last slide before I get to have the actual students and applicants start talking. Okay, a little bit deeper dive into all the things that we get to do. This is my whole world, is pre-health advising. So I don't also kind of moonlight as a career advisor elsewhere or teach classes. So this is it, okay? And I think that's a really important part of why I get to dig so deep into this work with my students and my applicants. I do a lot of proactive outreach. My goal is to preemptively anticipate the things that my students and applicants need to know that they don't know yet that they need to know, and then tell them before they need to know it. And so there's a lot of proactive outreach that happens. That happens through weekly communication, a lot of tailored outreach, depending on what somebody's long-term career goals are, or academic standing or class standing. There are a number of things that are mandatory for all of our students, but most what we do is tailored one-on-one, because everybody's journey is slightly different. Like I said, we do advising for all pre-health programs in one spot. I think my last count, it's something like 32 professional health careers total, or kind of the current max of where we're at. Hospital administrator, hospital social worker, what else is it? Anesthesiologist assistant, you name it. Anything that's health related, animal or human, falls under my purview. We do a big suite of advising support services for applicants. So they're listed here. It's definitely not an exhaustive list. There's a lot that goes into working with our applicants navigating the process. The most important thing I want to say is the relationship is lifelong. So, okay, what that means is you're one of mine the moment you say you're coming, and then you can't really shake me. So even when you're in your graduate program and you're in med school, you're in your nursing program, you're in whatever, I still want to hear updates and I'm going to ask you and I want you to come visit me on campus and I'm going to be curious and okay. So it's really lifelong because it feels personal to me. I'm so invested in y'all's journey. And it's just a really special joy that I get to walk alongside y'all. There's a lot of joy and happy moments that come with this, and there's a lot of hard moments too. This is not for the faint of heart. This is a tough road y'all are traveling, and you get a lot of respect from me for doing it. And so sometimes all that I can do is just be a listening ear and be your cheerleader. But if that's all I can do, I'm going to do it for you. Okay. So you get me for life. All right. Okay. Now, oh, shoot, there's one more thing. Sorry, y'alls. I was all excited. Okay. Um, I'm not going to go in detail about this. It's too tiny. The visual though here is that there is a journey, there is a method to the madness that all of our pre-health students follow. And yet everybody's journey will be a little bit different. Okay. So if you're coming in first time in college, no AP, IB, college high in the high school coursework, that's very different than someone entering as junior class standing, transferring in, right? The timelines are different. The life experience is different. My job is to meet you where you are and then figure out where on this kind of game board of sorts are we starting from. And so if you are a little bit further ahead, great. That's where we're going to start from. Okay. And then I think the final thing I'm going to say before I kick it over to the really fun people are if you are coming in with AP or IB credit or college in the high school, that often means that we're having conversation about do you jump ahead in a course series, maybe jump ahead in the Gen Chem or the Gen Bio series, or do we not do that for different reasons? If you have questions, let me know on this topic. I'm here all summer in the office, which is typically when IB and AP scores and results are coming in. So we can kind of talk through what that might mean and how it might impact your first semester classes. Similarly, if you've taken classes at the community college level or you're transferring from another university, I can do an unofficial evaluation of your unofficial transcript and see what that might mean in terms of prerequisites for your professional health graduate programs. Okay, so talk to me and we'll kind of talk through it in detail. Okay, now the fun people. All righty. Okay, so I am so excited to have joining with me this evening. Four lovely humans who are just remarkable rock stars. Okay, so we have a couple alums, and then we have a current student. So what I want is for them to just share their story because it means I think so much to hear you have y'all share it, and then these all y'all high school students and those that are coming in get to hear it. So we've got Ben Smith, Kobe Rodriguez, Eleanor Dunn, and Jordan Holman. Let's see. What I want to do is have each of you all, I mean, you can see I did a quick little snapshot of who you are, but what I want to have is I want to have each of you just do your own little introduction, who you are, where you're from, where you're at in terms of your schooling, your career plan, professional interest, and something that whatever most surprised you as you were going from high school into Puget Sound. Okay, so who are you, and what was or has been the most surprising thing as you made that transition into Puget Sound? I'm just going to call on folks. Okay, so Ben, you're up first.
Hi everyone. My name is Ben. I'm from Mountain View, California, or Bay Area. Um, my major was molecular and cellular biology. And I minored in math. I'm currently at Johns Hopkins in the master's program. So is Kobe. I actually just saw him 2 hours ago, so it's kind of funny seeing him here as well. Uh, and what was most surprising? For me, I didn't, especially my first year, because I didn't get into pre-health until like halfway through my sophomore year in undergrad. What was most surprising was like all the resources we have at University of Puget Sound. Like I didn't realize um, first, I didn't even. I remember the first time I went to Nova, I didn't even realize we had free health until my sophomore year, which was definitely all my fault. And then also access to getting into research. I did do research and getting into like all these different extracurriculars and things that I didn't realize like it was a lot easier to get into than I initially thought it would be.
Thank you, Ben. Okay, Kobe, I'll kick it over to you. Your Hopkins buddy.
Yeah, my name is Kobe. I'm originally from Yakima, Washington. My major was natural science in biology with an emphasis in biology. So I am also at Johns Hopkins, the Master of Nursing program. I should graduate in uh, August, and then I will start at a oncology research ICU at the Cleveland Clinic coming up right after graduation. Then I'll go on for my doctorate in nurse anesthesia, hopefully here soon. One thing that I found interesting from high school to undergrad is kind of along the same thing as Ben is the ability to get involved. In undergrad, I was involved in a whole lot. Nova knows this. I was a varsity football athlete, as well as I did research for Dr. Sosa. And I was in a bunch of different clubs. And so that's one thing I loved about Puget. It makes it super easy to kind of get involved and be involved in multiple things. I don't think it would be possible many places elsewhere.
Thank you, Kobe. All right, Eleanor, you're up.
Hi everybody. I'm actually still a student here. I'm a freshman. So I just went through this process. I was actually on the Zoom meeting last year, so I know what you're going through. Um, but I'm also from the Bay Area, California. I have an honors minor and I'm currently on the path for either molecular and cellular biology or biochem. And something I found surprising was just all the fun things that you get to do through pre-health. Like I got to go to a suture clinic and that was absolutely fantastic. And I learned how to give an IV on a fake arm, of course, but like just all the amazing opportunities that you have.
Thank you, Eleanor. All right, Jordan.
Hi, everyone. Thanks so much for letting me come and be here today. Yes, my name's Jordan. I'm originally from a small like mountain town in Southern California. My major at Puget Sound was biology. Minor is in Spanish, and yeah, I graduated back in 2022, so a while ago now. But I'm now a first year medical student at University of California, Riverside, which is super exciting, and I've been loving it so far. Yeah, the thing that gosh surprised me the most when I was high school going into Puget Sound as a first year student. Um, just to ditto kind of what everyone has been talking about, just the incredible amount of resources and truly how like incredible Nova and the pre-health advising team is in general. Like I can't, and we'll get into it more, of course, as we go, but I honestly can't express to you guys how amazing they are and just how truly life-changing like they were in my journey to medicine. And I think also too, one thing to like note that was very surprising is that I obviously am biased in pre-med, but pre-health definitely does not have to look the same across the board. Like Ben mentioned that, oh, sorry, or Kobe mentioned that he did research, but I didn't because research wasn't something I was super interested in, but I did a lot more things as far as volunteering and whatnot. So Nova is just like the master of helping you navigate figuring out your story and how like things that you're interested in still fit into pre-health. So yeah, she's fantastic. Pre-health advising is fantastic. I cannot speak to it enough, truly. I know we'll get into it way more, but yeah, it's fantastic at Puget Sound for sure.
Oh, sweet. Thank you, Jordan. Um, okay, I want to now, let's see, let's talk more about your experiences here on campus. So each of you already mentioned this a little bit. Um, Research is a really common thing folks are interested in: clinical experience, athletics, leadership, study abroad. Uh, we can just kind of popcorn around, but I'd love to hear more about how did you find your spaces, your things? How did you do that? And maybe in hindsight, is there anything you wish you'd known or that you would give as advice to these incoming students? Let's maybe go reverse order this time. So we'll start with Jordan.
Yeah, so I would say, yeah, I spoke to a tiny bit there, but So at Puget Sound, to put it in context, I was also a student athlete. I played volleyball 4 years, and that was something that was really important to me as far as my college experiences. I still wanted to play my sport, and so like Nova spoke to at the beginning of the presentation, how supportive all of the coaching staff is. I think even across sports, I obviously witnessed that in volleyball, but I think similarly in football, and Kobe can mention that as well. But I think the coaches are really supportive of just how rigorous like a pre-health major could be. And they really helped out as far as like, maybe I have to come in slightly late to this practice, but I'll stay later, things kind of that sort. So yeah, so I was involved in that. And then through athletics was kind of where I found my niche as far as like leadership roles. That was something that was really important to me. So I was the president of our student athlete advisory committee during my time at Puget Sound, which I loved, and honestly really opened a lot of doors as far as like getting more experience for things like volunteering, which is huge for I think most pre-health programs, and getting really cool opportunities to do things like that. Like I worked at the Boys and Girls Club or volunteered, I should say, at the Boys and Girls Club during my time in college. I also had the opportunity to be involved in Greek life because, again, at Puget Sound, they just want you to be involved in everything, and it is really easy to do so because they really encourage that and they want you to be really well-rounded. So those are some of the things that I did at Puget Sound. But Nova could speak to this for my journey as well too. I think the majority of my mostly pre-health or like clinical experiences came after college. And I think that's also something to mention is that again, it doesn't have to look the same across the board. I ended up working as an MA for a while after college before med school, and that was my primary like clinical experience. So it doesn't have to be like during college. Of course, there's like ample opportunities at Puget Sound to do it more clinical based and like Eleanor spoke to as well, those like super cool things that they offer. But you can do it after too during gap years. And I'm happy to answer any questions about that too.
Mhm. Thank you. Ben, what did you get involved in and how did you find your place here on campus?
Yeah, so I already mentioned research. I did do research in the summer. I don't know if anyone's talked about research before for any of you guys, but there's kind of like two main things that most people do regarding research. You either do it during the summer or you can do it for credits during the semester with in either case, you would be with like a school faculty person who usually has their own project, but you can also like propose your own project if you have an idea and want to do that to basically a professor. Um, and I did my research in a completely different field than anything related to health, actually in organic chemistry, so you probably all think I'm crazy. But I really loved it because I had a really, really great advisor I was working with and a really good lab team. And it taught me a lot in regards to research. I was also involved in the Biohonor Society for 2 years. I was president of that in my senior year, so I was involved in that. And Nova, did you want me to talk about stuff like off campus or mainly just on campus?
You could talk about off campus, like neighborhood clinic or anything else.
Sure, yeah. So for the main reason I even got into healthcare in the first place is because when I went to Nova in my sophomore year, when I was switching from politics, because that's what I initially wanted to do, and then hated it, I she recommended to me looking into volunteering with the neighbor clinic, which is a urgent, basically kind of an urgent care type clinic for uninsured and underinsured patients. And that's what made me love healthcare and made me want to become a nurse because it was run by nurses. It was one of the most amazing experiences I ever got, and I did it until I left to come here in Baltimore. Even a year, I did a gap year after I graduated. Even in that year after, I was still there. 2 to 3 times a week because I loved it so much. And I also did during the school semester, I did something called the Copel Scholar Program, which is kind of like an internship where from you can depend you there's like a few different time lengths, but I did one for 15 months where I only had to do 4 hours a week. and that was way more manageable during the school year with all your classes. And if you're in like molecular cellular biology or chemistry where you have labs, it's just way more feasible than like becoming a CNA part-time or phlebotomist part-time. So that was what my path was. But I'm sure other people have other things too.
Thanks, Ben. Okay, Eleanor, you're what, 8 months in to your Puget Sound journey. How have you found your footing and kind of found your place in the things that you want to invest time in?
Yeah, I'm kind of like a unique case because I've only been here for around 8 months, but within that time, I'm like an active member in 5 different clubs. I also work on campus as a tour guide, and I'm also chair for our hall council and one of the members on the Resident Student Association. And our hall just got an award, so I'm really proud of us. Um, Thank you. Um, yeah, so and there's a lot of great leadership things that you can do there and interact with the community. One of the fun things I did was I helped organize this thing called Trunk or Treat, where you get to interact with all the neighborhood kids and they all come around and you like set up all your cars and they all come and pick out candy. And that's something I found I really liked because I got to lead for my hall with all freshmen and it kind of like diversified my circle of people I got to know. Um, yeah, and I'm a part of a lot of other clubs too. Yeah, and I love my job. So it's like there's a lot of different little things that you kind of like find your people in for that first year. And then on top, you're doing kind of other pre-health stuff. But I recommend kind of like finding your people and getting like settled in. It's just a nice feeling to have like a nice foundation.
Okay, Kobe, you're up.
Yeah, so I kind of alluded to it earlier. I was probably involved in a little too much. Um, But so yeah, I was a varsity football athlete, and like Jordan was saying, coaches are very for it. Um, they know the level of what it is, and they know kind of like what your priority is in terms of your career. So like every once in a while, labs were an issue in terms of missing practice or missing a portion of practice, and they were pretty well receiving of it. You wouldn't find that very many other places. Um, and so like even so I had a interview or an internship at Seattle Children's Hospital as well, where I worked with a bunch of different doctors and nurses to kind of perform research in their ED and kind of intervention screening for mental health in the Seattle area. And so I was late for fall camp for that. And so coach was pretty receptive about it. I didn't have any repercussions for it outside of like I need to put in extra work here and there. Other than that, I was pretty involved in campus. I was involved in Greek life, Roll Fi, as well as I was involved in several different clubs, including Visible Spectrum. So the people of color or POC in STEM type of club, and then as well as I was in got most of my clinical experience working night shift as a phlebotomist at Tacoma General, and also a little bit at the Children's Hospital there, Mary Bridge, which was fun. I got to really see and experience with that in Seattle Children's, kind of see where I wanted, what kind of profession I wanted. I knew I wanted to go into the space of healthcare. I just wasn't sure at the time. I also, in terms of leadership, created a nonprofit back home where I served at-risk youth for gang violence and drug abuse, as well as provided different healthcare systems or resources in that area. Um, but yeah, outside of that, there was a whole bunch of little clubs that I was involved in, as well as you definitely find your friend group and you definitely find a really good sense of community that I think took a lot of my time because social life was always important to me.
Yeah, so our students are really busy. Don't know when they sleep and eat. But what I think is just fun is listening to each of y'all talk. It sounds exceptional, but it's very normal here. This kind of doing all the things, and it's a really special thing that I think Puget Sound gives to our students, that you don't have to pick and choose which path you follow or which identity you lean into the most, that you really can kind of try it all, and then decide where you want to put your effort and your time. Okay, I want to talk about application stuff. Okay, so this is going to be more for Jordan, Ben, and Kobe. Okay, so y'all have navigated now this big adventure of applying to graduate programs for med school and nursing. Let's just talk about what that process was like. I don't really have a particular prompt because I know each of your journeys were quite different. And the process therefore felt different. So whoever wants to go first, maybe we'll have Ben, you want to go first this time, and then Jordan, and then Kobe. What was the process like to apply? Just words of wisdom. What do you wish you'd known? Kind of just lay it all out there.
Yeah, so you'll learn this later on if you're going into nursing, but unlike some of the other health professions, a lot of the nursing applications are not like standardized. And so every school has like a completely different like list of requirements they need or like special things you need and they're not a lot of them are not on like the same standardized place to apply, which is really annoying. Um, but in terms of like application, I actually only ended up applying to three places because I only wanted to go to those three places. I don't think that's necessarily normal. I think most people apply to more than that. I but I was really set on those three places because they kind of when I was doing all the like orientations, like look basically doing what you guys are doing, but for grad school. I those are the only three that really hit me. And it's kind of similar to applying to undergrad. You kind of have the same types of questions. The only difference is for nursing school, a lot of them want you to do the GRE, which is like another kind of like standardized test similar to like an ACT or an SAT. Um, it's it's honestly, I didn't find it that much different than applying in undergrad. It's kind of like, why do you want to be it's like similar types of questions, except it's like, why do you want to be a nurse? Why do you want, like, what's a time that you failed and overcame it? Those like type of general admission questions. I don't remember any like particular thing tripping me up. Um, and unlike like med school and some other ones, we don't have interviews. So we just find out if we get in or don't for the most, at least as far as I know. No one might correct me if there's some schools that you do have interviews at, but um, I didn't have to do an interview at least.
Yeah, you were lucky, Ben. There's a number. Yeah, Kobe's saying, yeah, there are. Yeah, nursing's kind of a mixed bag. PT, OT, there's a number of the allied health professions where half of them ish do interviews and half don't. And so it's just sort of the composition of whichever schools you're applying to. So yeah. Okay, Jordan, your application journey.
Yeah, okay. So my application journey. So I mentioned slightly, but yeah, I took a couple gap years. It ended up being three. I will say for medical school, the application process, and I'm assuming nursing is similar. But it's long. It's basically like a year-ish long as far as like the actual application process, but then prep and whatnot is almost a whole other year. So yeah, it kind of like ended up being around like a year and a half, 2 years as far as the entire process. Um, but again, Nova will guide you along with her the entire time, so you don't have to worry at all. Like she will help you, so you are all good. But bird's eye view of it, the first thing that kind of been mentioned is like standardized testing. So there's the MCAT for medical school. That's kind of a whole other beast within itself. Not to like dive incredibly deep, but so yeah, so I think just preparing for that takes a while. For me, I ended up taking it twice, which is not uncommon. I would say the majority of my med school friends now were similar, like two, maybe three times, um, for like taking the exam just because you have to study for a good chunk of it. It's not like I'd say it's not quite like an SAT or an ACT in the sense of it's a little bit more like specialized knowledge, if you will, if that's the right terminology. Like there's science sections, there's reading comprehension sections, there's psychology sections, et cetera, et cetera. But again, Nova will hold your hand, so don't worry. And so there's that. And then Essentially for med school, there's like a couple different sections of the application. So there's primary applications, which sounds similar to kind of what Ben mentioned, like written applications as far as like, why medicine. The lucky thing about medical school is that it is standardized. So I'm so sorry for Ben and Kobe that that wasn't for nursing. It is standardized, that first application. So it's just kind of like more broad questions, and you arrange your activities and things of that sort. And then you get secondaries, they're called. I don't know if people have heard of that, but essentially schools that like you from the first process reach back out again and then ask you a little bit more specific questions, essentially about why our school. And so you answer more written application questions from there. And then if you're lucky enough after the second process, you'll get invited for interviews. Now, post COVID-19, the large majority of interviews are virtual, which is honestly a big blessing. So you don't have to pay for travel or anything like that. And then I will say again, just to like praise pre-health advising to the nth degree. They prepared me so well for my interviews, the mock interviews. I ended up doing that twice, and they were fantastic. Like just getting me overly prepared for my interviews. I didn't feel like anything came out of left field. I felt very prepared. I felt very comfortable speaking with admissions teams and stuff like that. And then after that, if they like you, you'll get offered a spot at their school. So it's long, but it's worth it. It's really rewarding. And again, like I said, Nova will guide you through it the entire way. So there's nothing to be worried about.
Yeah, it is a marathon. That is for truth. Yeah. Yeah. Kobe, anything else you want to add that hasn't already been mentioned?
Yeah, so like Ben was saying, it's a long process, and like Jordan was saying, it was a long process. Um, I ended up applying to mainly nurse practitioner schools. The program that we are in is a accelerated program, but it's built for like transference for your doctorate in a separate kind of program to get your NP later on. However, so a lot of the programs you can end up applying to like direct entry NP programs. And so when you graduate, you'll come out with an NP, so a nurse practitioner. However, like Hopkins, you'll go through the MSN and then you transfer into a separate program to get that nurse practitioner, and you come out with your RN after about a year and a half um, with your MSN. And so it's a separate area. However, I think Nova really helps and the advising really helps because I was originally going into acute care nurse practitioner. So the ED, because that's really all I worked in up until that point. And Nova was pretty pretty helpful in terms of exploring my options. And then I ended up settling on anesthesia and wanting to go that route with my nursing career. So I think, yeah, so really keep your eye open, really keep your mind open, especially during the application process, because you never know. Especially, I'm sure once you even get into a grad program, you're going to see some specialties that you never even knew existed, and you're going to be like, dang, that's actually really cool. So the healthcare system is massive. Really take your time going through each different role, each different specialty, each different area, because there is something for everyone.
Very true. Yeah. Okay, so I want to talk about Puget Sound. How do you think, if you had to pick a way, an experience, something that's maybe it was a class, maybe it was a professor, maybe it was an opportunity, if there's something you're like, ooh, that really at Puget Sound prepared me well for now what I'm doing in my graduate school. And then for Eleanor, I'm curious, what is something that maybe when you were looking at considering where you wanted to be for your college home, what is something that you were kind of hunting for that you thought, ooh, that's probably going to be really important for me? So let's maybe start with Eleanor. We'll just throw you.
Okay. So something that was really important for me was like finding a group of people that would really support me through the whole process and not just advising, but also faculty and staff. And the faculty here are so helpful. I actually just went to my chemistry professor the other day and was like, hey, I'm like really confused on some of the like course requirements in order to get into this one class. Could you just go over them with me and like walk me through like what you think would be a good idea? And she was like, yeah, like I just sit down with me, like we can have lunch and like I'll walk you through all of it. And that was something that I really wanted in the school. faculty that really wanted to help me and help me get to where I wanted to be and took a genuine interest in my life. And I get a lot of professors coming up to me like, Ella, how's pre-health going? Like, I'm rooting for you. I can't wait for you to become a doctor. And that's really sweet, just walking through the halls and having people come up to you and say that.
Yeah, that is so true. Yes. Jordan, how about you? What was something that in hindsight you think, ooh, that really served me well as I'm now in med school?
Yeah, I think honestly, slightly similar to Eleanor's response there. I think small schools just in general are sometimes a little underrated in that sense. Like the fact that at least when I was at Puget Sound, kind of the culture around like professors, for example, is that we called the large majority of them by their first name. Like that's how close of a connection you're going to have with your professors. And our class sizes, gosh, I'm like the admin may correct me on these numbers, but I don't remember any of my class sizes being larger than about like 30 or 40. And that was like even for first year, like larger gen ed situations. And so I think that is just so beyond valuable. Um, Obviously, primarily because of your education, I think that educational value is huge. I feel like I really understood concepts well because I had the opportunity to go into office hours and feel super comfortable to talk to my professor. Again, knew me by my first name, knew that I played volleyball, checking up on me, things like that. Gosh, I think that just goes so far in your career. And then, secondarily to that, when I was going back and applying to med school, asking for letters of recommendation, even a couple years after, they all still remembered me like by my first name because again, you were able to build such strong connections because class sizes were smaller. They really do genuinely care so much about you, and you're able to be involved in a lot too. So you can get letters of recommendation from a large majority or like a wide variety of people, which I think also makes you stand out as an applicant. Like I think mine were like my coach, like the Spanish like program director, the bio program director, like it was like kind of a mixed bag, which I think is really fun too. You have the opportunity to like learn a lot and be really like interdisciplinary. So yeah, Puget Sound is the best. I could talk about it forever.
All right, Kobe, Ben, whoever wants to go next.
I can go. Yeah, I think kind of along the same boat. The class sizes really made it personal. So yeah, all my professors knew me by first name basis. I'm not necessarily one to be quiet. So especially with that small class, they were very like willing to be personable with me, willing to be not only professors, but kind of your friend in a way, which really ended up helping with references and letters of rec when it really came down to it. And especially with applications to grad schools, you are going to have a lot of them. And getting to be on top of it is really important. And I think the professors, honestly, are very on top of it. I didn't have a problem with any of the professors at Puget, at least in terms of letters of rec. Um, they were lovely to work with. And then especially use your resources, use the health advising office. Nova is great. She walked me through everything. It was like a step-by-step thing. I met with her like at least once every couple of weeks. It was great.
Yeah. Yeah, there's no limit to how much I will never say, oh, sorry, you've exceeded your number of advising appointments. It's more is more. And for those who haven't visited campus, my office is in the science building quite intentionally. So I am right in the mix of labs and lectures, and it's quite intentional. So I'm not hidden in some little corner of an administrative building. I'm very accessible. I share a break room with the biology department. That's all by design.
Nova, with about 10 minutes left to go, we've got some really fantastic questions that I want to make sure that we get to. So, were there any other questions you wanted to ask our students? Some of what's coming is also, I think, going to be perfect
No?
for them.
Let's
I'll ask that we address this a little bit like a lightning round because I want to make sure that we get as much covered as we possibly can. But I just want to, before I get to that, say thank you, Nova, Eleanor, Ben, Jordan, Kobe, for sharing your experiences. I think this is really, really invaluable for students in high school as they're thinking about their options for college and kind of from go what their path is going to be. And that was actually one question that came up a lot in the Q&A is just making sure students understand Nova. How do they get signed up on your radar? What's the official thing they need to do to make sure that they're working with you?
Yeah, it's very simple. Okay, so this summer you'll do what's called an academic program questionnaire. So after you pay your deposit in July, you get sent this very long survey, asks you lots of questions. What do you want to be? What do you like? Hobbies, interests, career, all the things. One of the options is, are you interested in pre-health? Yes or no. That's it. All you do is yes, the end. That's all. There's nothing else you have to do. Okay. So then you're on my radar. And then you'll start hearing from me in early August. And then we'll interact a couple times during orientation. There's a lot of times that we start having interactions those first couple weeks. So yeah, it's real simple.
Great. How early can we sign up or look for internship opportunities at any of the nearby hospitals? Is it unusual to start internships during the school year, or would you recommend during the summertime for success?
Oh, my advice is that first semester, if you know your pre-health, first semester, find one clinical experience and one volunteer experience. That's the expectation. So, and it's not to overwhelm you right away, but it's to say, okay, if we think this is what you're interested in, let's get in there. Let's try it on. Let's try. If you did something similar in high school, what do we want to do differently in college? Oh yeah, and like I think maybe it was Ben was talking about with Cope. A lot of the volunteering and clinical experiences are just 1 4-hour shift per week. So you can do that on a Saturday morning, a Sunday afternoon. They really do complement your academic course load quite well without overwhelming you right off the bat.
Yeah.
And I'll help you with all that. You don't need to, if you're new to the area, you don't need to know where to go. That's okay. We'll figure it out together.
We had a couple questions about nursing. The first one was with regard to the acceptance rate into nursing programs. Was that all to accelerated nursing programs?
That is a mixture of, so our applicants apply to a combination of accelerated BSN, entry level MSN, which is what Kobe and Ben have done, and direct entry NP, nurse practitioner. And so the majority of our nursing applicants apply typically to MSN and NP. Every now and then I have an accelerated BSN, but that acceptance rate is altogether packaged.
And if students are interested in RN and not necessarily a master's in nursing, do they what are their options? Are they probably looking at a transfer? How does that work?
Yeah, so I do have quite a few students that are not right now when they come into Puget Sound thinking that MSN or NP is the end goal, maybe more of an accelerated BSN RN combo. I think what Kobe and Ben kind of alluded to is that the nursing paths, there's a lot of them. So part of my job is to really sort out, okay, what's the long-term career goal and which path really does make the most sense. Let's not prematurely pick a path until we've really confirmed that it's the right choice. Then we can talk through the logistics and the mechanics. The thing that I see with a lot of my nursing students is that they are mostly nursing, but they maybe want to keep the option of PA open, or mostly nursing, but maybe med school. So the other nice thing is that you get time to really sort that out. You don't have to jump into a decision from day one. You can take a couple years. All the foundational courses are the same across the board. We get the clinical experience, and then we figure out, okay, what do we do from here? So that when you jump into whatever that program is, you feel really confident that you know it's the right choice for you. It's worth the money, the time, the effort, etc.
Yeah.
So lots of choices, lots of options, but there's no urgency in knowing at the front end.
For this next question, I'd love to hear from you, but also if the students have perspective. It's really about research. Are there opportunities to engage in medical research as a pre-health student, and how early are research opportunities available for students at Puget Sound? How early in their time?
Yeah, I'll say the how early, and then Ben and Kobe. Second semester, first year is typically the early point. A lot of the faculty want you to have 1 semester under your belt. And then you can jump into it. We don't have TAs teaching class, no graduate students. You're not competing for research with graduate students or TAs or postdocs. So it's the undergrads who are doing the research and getting published and co-authored in paper. Okay, so pretty cool stuff. Okay, so Ben and Kobe, y'all did lots of research.
Yeah, you definitely have time to do research in undergrad, as well as there's a bunch of different internships. Like I said, Seattle Children has a great one. I would recommend applying. It's great. It lets you work with both MDs, NPs, RNs to do direct patient care type research. And so that's all within the surrounding area.
Also, I want to highlight, if you're interested in oncology specifically, Fred Hutch is very close, and they have a lot of programs that a lot of students go to.
Yeah, excellent, excellent. Next question for anybody. How hard is it to balance classes for your intended major plus classes needed for med school?
Jordan, you want to take that one?
Sure. I would say, gosh, again, just with the help of the pre-health advising, not too hard at all, truthfully. They do such a good job of arranging your schedule to like align, like, okay, this class covers this requirement and this requirement. So it's kind of like a 2-for-1 for you there. They do such a good job helping you with that. And then kind of like Nova mentioned earlier, like truthfully, everyone at Puget Sound does a ton of stuff. So you're not going to be by yourself doing a million things. Like everybody's in it with you. Everyone's encouraging you to do well and like support you and offer those resources. So even though it's hard, it's so doable and they do such a good job of supporting you through it. So I would say you can do it.
I will say, so I've been here almost 8 years. I've never had a pre-health student have to take more than 4 years to graduate, ever. I've had some folks who were athletes who opted for a 5th-year eligibility for sports, usually fall athletes who wanted just to hang out for an extra semester, take some electives, like they weren't going to be collegiate, super, so fair, totally fine. But that was by choice. But I've never had a student have to take more than 4 years to graduate. And I am committed to that. That's a big priority for me as an advisor.
Can I say something real quick?
Yeah.
If you're doing any biology major, any chemistry major, exercise science, something like that, a lot of the pre-health requirements overlap with those majors. So it's like you're taking it anyways for your major. So it makes it a lot easier.
In a few words, what about the direct admission pathways to PT and OT for Puget Sound undergrads? How does this differ from pre-health or pre-med students applying to other grad schools? What can students do to prepare?
Yeah. Oh, yeah. Good question. Okay. So if you're thinking PT, we do have a guaranteed admission option. So if you come into Puget Sound, you do your undergrad here, you meet certain eligibility criteria, you are guaranteed admission into our DPT program, which is just lovely. So much stress off your shoulders. And so there's nothing you have to though commit to at the front end. There's nothing we're making you sign in terms of a contract or anything. All I need to know at the front end is that you're interested in staying here for PT. And then I will tell you all the things we got to do to keep you eligible for consideration. Okay. So there's nothing binding. With OT, there's a 3-3 and 3-2 option, which means that we kind of accelerate your undergraduate and your graduate coursework together. So if you're thinking a master's of science in occupational therapy, normally it would be 4 years plus 2 years graduate. We make it all happen in 5. And if you're thinking the doctorate, normally that would be 4 years plus 3 years. We make it happen in 6. Okay. So we shave off a year. You basically are starting grad school while finishing your senior year here. Again, not binding, nothing contractual. All I have to know at the front end is that you're thinking about that if you're pre-OT, and everything else will sort out.
I'm scanning through. I think we have time for one more question. Is it realistic to double major, have a minor, and can compete in athletics? Kobe and Jordan, quick, yes or no?
100% yes. Very, very feasible.
I think so. It might be a little stressful, but it's definitely doable.
Yeah. Wonderful. So I apologize. There were a couple more questions I was hoping to get to, but there was such good content this evening that I didn't. A lot of those were kind of answered in the conversation. So if you had any questions that we were not able to answer, admission@pugetsound.edu. We can get questions to Nova. Nova can solicit opinions from students and alumni. We will take good care of you and make sure that we get those questions answered. So once again, if you feel like Puget Sound is your place and you want to join us, the deadline to deposit is May 1st, and all of the information is available at pugetsound.edu/secure your spot. And then mark your calendar for move-in and the start of orientation on Friday, August 21st, and the first day of classes on the 31st. And from all of us at Puget Sound, thank you for your time. Thank you for coming this evening. Nova students, again, thank you. And we have recorded this, so we'll be able to distribute that to attendees as well. And for everybody who came, thanks so much. Have a wonderful evening. Good night, all.
Thanks, y'all. Bye.